You could have someone who literally is moments from dying, and then you could be the person that ultimately saves someone's life. I don't think there's anything better than that. My name is Kyani and I'm an emergency doctor here in Dubbo. What makes me a good emergency doctor is that I like a fast-paced environment. I seek a challenge. Everyone that hits our front door, you never know what you're going to get. I grew up in Dubbo and then made the decision to go to Sydney and study at the University of New South Wales. Through that time I realised that I'm very passionate about rural and remote health, so that's sort of what drove me to come home, and what better place to come than your own hometown and give back to your own community. Being an Indigenous doctor, I'm very understanding of the social aspects of health. We are really setting the scene. We cater to a significant portion of Western New South Wales. We see people from remote communities who might be 3.5 hours away from our base, and so we already are having to start to coordinate their care. We have to think outside the square sometimes, and it makes the medicine we do really interesting and rewarding. Being a trainee here, you get the opportunity to be hands-on straight away, leading, resus scenarios. You will be the one performing procedures, obviously supported, but you'll be the one actually guiding your patient's care. I'm always upskilling, learning, growing as a doctor. My supervisors are very supportive. They all appreciate the demand that our work life puts on us, so they're certainly there to support you and make sure that you are doing okay. Dubbo, I think, is a fantastic place. We're in a great location, but it's also just a beautiful community to live in. One of my favourite things to do is to find a nice little quiet spot down by the river. It's beautiful. If you're very passionate about emergency medicine, you have a real opportunity to work with an amazing team and make a really big impact on your patients and their families.